Good morning, and thank you for inviting me to be part of today's event. I am Michael Heffernan, and I serve as Governor Baker's Secretary for Administration and Finance. I'm grateful to be with you to kick off this morning's event and showcase the results of the Pay for Success program and to share our intention for continued collaboration together. The Pay for Success program and the work done with all partners inside and outside of state government embodies so much of the passion and creativity needed to tackle these big problems. I do want to thank some of those partners right off the top. Members of the Massachusetts Housing and Shelter Alliance, the United Way of Massachusetts, Santander, and the Corporation of Supportive Housing. In the Pay for Success context, A&F has been engaged in 4 such projects with similar frameworks, each attempting to address different chronic social ills over an extended period of time. This particular project is distinct from the others in several ways, in large part because the project leverages a great deal of state dollars rather than relying exclusively on private sources for working capital. Key to this was how we reformed Medicaid billing and the processes close to a critical funding gap in incentivizing wraparound services. The Massachusetts Medicaid office used an 1115 waiver to allow reimbursements for health and behavioral service providers on a per diem rather than fee-for-service basis, allowing the provision of community-based wraparound services. This new structure made possible a more holistic and efficient service delivery through wraparound services. This and other factors highlight for us at least 2 important observations of the model. First, Pay for Success is helping to catalyze reformation by bringing together decision makers from various agencies and stakeholders to the same table. And second, PFS causes those at the table to focus on outcomes that are both measurably improve lives of those we aim to help and measurably result in meaningful savings to the government as a payer and as a result of an effective intervention. The objective of this initiative was to serve between 500 and 800 homeless individuals over 6 years who have disabling conditions and are at high risk of high healthcare costs. We are humbled and thrilled to see that we exceeded these goals together. As of July 2021, the PFS program has housed 1,055 tenants. This summer, we made our final success payments under the project, entirely compensating the $6 million invested in the achievement of outcomes associated with reduced government expenditures. I was pleased to support the continuation of this program under what we call the 2.0 framework. The 145 sponsor-based vouchers in circulation will be reassigned to other eligible homeless individuals when current holders move or leave the program for other reasons. This fall, Mass Health will pursue a renewal of its Section 115 waiver with the hope of expanding the Medicaid reimbursement eligibility beyond the HUD definition of chronically homeless to encompass not just those who have been homeless a certain number of times or for a certain duration in a given time period, but also to those who are high utilizers of certain Mass Health services. This would allow for services provided to people participating in the program that do not qualify under the existing definition to also be Medicaid reimbursable. Our continued success will always depend on our ongoing collaboration across agencies and various stakeholders. This will be the necessary ingredient for us to continue to improve and reform how we address complex issues together. I very much look forward to enjoying the rest of this morning's event, and thank you.
Thank you very much, Secretary Heffernan, and thank you and all of the Secretariat of Administration and Finance for all the support of this experiment we call Pay for Success. All of your staff were great support, but especially Assistant Secretary Mark Attia, who has been with us pretty much right from the start. So again, thank you all very much. I'm very happy to have with us here this morning Tom Brigham, who is one of the architects who actually helped to put the Pay for Success on the ground with the various providers across the Commonwealth. And Tom, welcome.
Thank you, Joe. Glad to be here.
You know, Tom, I was thinking back as this is coming to an end now, the Pay for Success. I was thinking at the 2 years of negotiations it took as we were putting it together, that oftentimes after everybody else had left the room, I would look to you and say, after all this modeling that you had done with Mahasa staffer Doug Tedrow, Board of Director Don Green, and I'd say to you, are you sure this can work? and you would always say, yeah, I think it can work. Well, at the end of it all now, with over 1,000 people housed and a retention rate of 85%, which, by the way, that was what we had projected, and evidence that suggests that it not only saved money, but it radically changed the utilization of many of the tenants of the healthcare and behavioral healthcare systems. So, one question: how did you know that it was? Why were you so certain that it was going to work?
Well, and I believe I said I knew it would work, not that I think it would work. I knew it would work. And much of that was from the experience of working with Home and Healthy for Good and many of the same providers, and knowing the great work that the providers do to get people off the street and out of the shelters and into housing. I knew we could do it, and I knew one of the pieces that had been missing was a connection to some of the service dollars that we were bringing to the table. So I knew it could work.
Well, I know that part of what we had to do back at the time was convince all of these providers that this was an experiment worth doing, and that it really required, given the fact that the pay for success alone was not going to pay for it, it required weaving together a wide array of services and leveraging housing dollars and all other types of resources and the like. So what is it that you think really made the difference?
I think the biggest difference was the expansion of Cspec. Cspec really was, even prior to Home and Healthy for Good, as a service dollars for permanent supportive housing coming from Medicaid. We were able to go from one managed care entity providing Cspec to all of them, which went from maybe 30% of the population to 80 to 90%. And I think that made a huge difference in being able to have some service resources to help people to stay housed.
I think we're going to be hearing a little bit more about that from some folks later as well, but Cspec, or the Community Support Program for Persons Experiencing Chronic Homelessness, again, as you said, was a big part of this. And what was interesting too as well is that it was expanded beyond the HUD definition of chronic homelessness, instead relied on a kind of unique triage system that I know Dr. Monica Burrell actually and Dr. Jesse Gator were kind of critical in helping us develop. But do you want to talk a little bit about that triage system?
Sure. We were able to, as you say, with their help, put this triage system together that looked at different diagnoses and assumed costs, and being able to really target the highest utilizers of the healthcare system to be able to get those folks into the housing, because we knew, especially from Home and Healthy for Good and from other studies, that just the ability of getting people housed dramatically reduced their healthcare costs from one year to the next when you compare them to when they're homeless.
I think one of the great results now as we witness is the expansion, or the proposed expansion in the new Medicaid waiver that the state's putting forward, is utilizing Mass Health in all types of different types of housing interventions. So again, I know there's any number of things that we can point to, whether it was the Corporation of Supportive Housing and the learning collaboratives that were constructed and bringing people together that made a big difference. But all in all, what is it that just, again, stands out apart from the Medicaid engagement? What really stands out to you about this whole thing?
Well, for me personally, it was working with so many really committed people that were working directly with the tenants, the tenant support folks that created their collaboration with the tenant themselves to follow the tenant's goals around their own life goals and really help them to stay housed. In those learning collaboratives, as you say, we're able to get all of the providers together in the same room to learn from each other. I was able to learn from them. It was really the people that really make this work, those tenant support staff.
Well, Tom, thanks so much for coming in this morning again. And I think, well, I'm sure you probably even know this, but you'd be happy to know that the great work that you started is continued to be carried on with Joyce Tavon and Emily Dobbinspec here at Mahasa, but also us working together with the Corporation for Supportive Housing and with United Way to again utilize MASH to create additional and more supportive housing as we move forward towards ending homelessness.
I'm thrilled to be here today. I'm here because of Joe Finn and his vision and the vision he shared with me and many other people. A few years back, Joe said, listen, Arthur, we can make a big difference in chronic homelessness. I think we have the pieces together to do it. I'm a believer in the avoided costs of homelessness adding up to a sum of money that we could use to end more homelessness, and I want you to help us get it done. And for me, this was new. I'm a developer. I'm a development professional by training and experience. And so when Aaron pulled me and Liz Rogers aside and said, I need you guys to look into this to see if it's going to happen. I'm worried that it won't. And if it can happen, I want it to happen. You know, Joe Finn has been a force against chronic homelessness and individual homelessness in this state for years, and he needs to feel like we did every single thing that's possible to make this happen. So I need you and Liz to make that happen. Aaron Gorenstein, our former Undersecretary for the Department of Community Housing and Development, I was his deputy back in the day. So I had a chance to meet Professor Liebman, who shared some of the same concerns and skepticism that Joe did about the dollar amount available to end this homelessness among these chronic individuals. Worried that the sum of money saved per year would not be adequate to close the gap. But that's one of the things that excited me about the opportunity to work on this with Joe and the team, which was closing capital and operating gaps is something I've been working on for my whole career. So I had a chance to collaborate with other people leading at DHCD at the time to try to figure out how to get enough housing resources and enough services operating support to make this project happen. It became a mission to close a gap. We had an initial allocation that was going to come from this savings that Jeff had shown, but we had to find a way to provide the sort of rental assistance and the services needed to make the project function. So I want to thank Elizabeth Heyer and Brendan Goodwin from DHCD, who sat down and sort of sharpened pencils with me to help figure out how to get MRVP or the Massachusetts version of the mobile Section 8 voucher in play to close that rental gap that was required for the people to make sure they could stay in the great housing that people like Jim Cuddy and others are providing. And then, as I was sort of sharing with Joe earlier, probably one of the scarier meetings I've had to do over the last few years in terms of like how crucial a specific opinion would be to the success of a venture. Our sit down with HHS, where they said that they would expand Cspec to make those services available to people in units. That was a very important meeting, and thank goodness that those two things came together. And what we got was a structure that could attract the kind of capital that Mike Durkin and Administration Finance was ready to get behind. So what came of that push and that the animation of the entire team by the vision that Joe and Mahasa had is why we're here today and why we have a successful project that has housed many people. And again, the thing that's different about from this part of the housing work from the development part that I'm typically in is that a chronically homeless person, their life could be changed and my life might be saved by access to this housing with the enrichment of the services. So knowing that Cspec was going to be the thing that made the difference, and the fact that the decision was made to invest it in this project has had a long-term impact. It's been a proof of concept. I think going into this, we all knew what services and housing do together, but the examples were out there. But there wasn't an experiment quite like this to sort of show it. And today, we have that example. We've also been able to show that using a novel financial approach, that it can be something that breaks even and even provides return to the people who make the investment. This proof of concept is important. This is a project that I worked on seven or 8 years ago. Now I'm a federal official, and I have a chance to take the things I've learned from that project and work with other professionals around the country to hopefully implement and create more permanent supportive housing. Again, with the concepts and the knowledge that this system can work. So with that, I would just say cheers to everybody involved, and thank you for getting me engaged. And just to Joe in particular, thank you for animating this entire discussion and this entire project with the good energy that we can end chronic homelessness that we all need to be reminded of every day. So with that, thanks so much for the invitation, and cheers.
What we did and how we did it with permanent supportive housing is truly a major accomplishment for our community and the people in it. And I think what Mahasa did of bringing together United Way, the Corporation for Supportive Housing, and 15 nonprofit shelter and housing providers to make permanent change in the lives of individuals is something we all have an opportunity to celebrate. Not to stop here, because there's more to do, but we've got a model that works. As I think about this, first of all, the how, there were really 3 or 4 things that made this work successful. One of them was the element of collaboration, where organizations who don't always get along well together came together to make a difference. United Way was founded on a belief that we're better together, and the Pay for Success program that we have demonstrated that clearly to everybody. The second thing that happened, and very importantly, we learned that donors and supporters wanted something that works. As we talked to potential donors to be investors in this, they didn't care about the investment model. What they cared about is, did we have something that was really going to work, that was going to fix a problem, not just sustain people in a situation, but allow individuals to move on to a better place. I think that was critical as we brought together individuals who wanted to make change on the behalf of others. The third thing to me is that we were working on something that is broad and able to be sustained. The model that came out of this, the MASH model, Mahasa's work, United Way, and others' participation, is something that we know we have now, and it's up to us to find ways to sustain it and grow it. And the fourth thing, and I think this is also critically important, we demonstrated to people that the situation that exists in our community and across the country does not have to be the way it always is. What we did was give a chance to people to fix a problem, and people joined together to do that. So the idea that the poor will always be with us, with all due respect to biblical text, is not the way it has to be. We've got a chance, you and me and organizations throughout our community, to make a difference. So I think about this, and I think about the words of this permanent supported housing. Most of us have 2 pieces of those and don't need a third: permanent and housing. And when you think about what we've done here is to give a gift to individuals who many times never thought they would have that or never have it again. People who slept on the floor so they could look under the door of the shelter to make sure nobody was coming. People who thought the best they could do was to sleep in an alley or in a very cold place. What we did is give them something permanent, and we gave them a home. It doesn't get any better than that.
Hello, I'm Bob Giannino, Anson, President and CEO of the United Way of Massachusetts Bay and Merrimack Valley. As someone whose family has benefited from numerous public policy efforts aimed at keeping families safe, housed, and well supported, this work is deeply meaningful and personal to me, and I'm grateful to be a part of this important event. I'd like to begin by thanking Governor Baker, Secretary Keneally, Secretary Souters, and Secretary Heffernan for your continued partnership in this effort to both address the needs of some of our most vulnerable residents and leverage existing state resources in innovative new ways. None of us will be able to solve homelessness on our own, and the Commonwealth took a bold step to partner and help lead this transformational work. I'd also like to thank Santander for joining United Way in making the critical investment needed to seed this approach. To Joe, Tom, and the entire team at Mahasa, your vision of ensuring individuals are home and healthy for good created the foundation that enabled this work to be brought to scale. We're also grateful to our provider partners for your commitment to fostering a safe, supportive environment for individuals to thrive. Now, we have a unique window to build on the best practices of what we've achieved in the Commonwealth through our Pay for Success work. We can use the key learnings from the project to strengthen the coordination and delivery of supportive services that empower families, individuals, and youth to exit double-up housing, emergency shelter, and the streets. We not only provided housing for over 1,000 chronically homeless individuals through our Pay for Success partnership, but we've also seeded and developed a proof of concept for other states to follow. We've shown that supportive housing works, particularly for individuals who are experiencing complex health challenges. Ensuring housing stability has also generated positive community benefits, such as reducing emergency room use, shelter stays, and other inpatient services aimed at addressing substance use disorder or mental health issues. While we must celebrate this progress, we also have an obligation to not let the work end here. The COVID-19 pandemic has revealed the inadequacy of our region's social safety net in meeting the needs of those who are experiencing homelessness. History will judge us not if we are too bold or ambitious, but rather if we remain complacent or think too small. Supportive housing is a highly effective, cost-efficient strategy, and we have an opportunity to expand this proven model to youth and families who are equally vulnerable. To do that, we must continue braiding public and private funding sources and streamlining the administration of services to adults, youth, and families experiencing homelessness. As we begin the next chapter of this work together, we're focused on creating a nimble pot of state funding through new legislation that would help meet the complex health and housing needs of our most vulnerable residents and fill in critical gaps. We're building public will to create a comprehensive plan to close the statewide gap of 160,000 units needed to provide supportive housing for all. Developing a unified collective strategy to create housing and supportive services for high-need, high-user populations to save lives and public resources. The need to provide permanent supportive housing to chronically homeless men, women, and children has never been more acute. Homelessness is a public health crisis, and as our state continues to face the challenges of the COVID-19 pandemic, we must reimagine and rebuild the systems to provide safe, stable housing for everyone.
My name is Steve Wilkins, and I work at a company called Commonwealth Land Trust. We do low-income housing for people that are homeless in a shelter and disabled, and the PFS program helps us to house folks in some of our unsubsidized units so we could help them get housing first model instead of going through processes for subsidy programs. So we have about 350 units of SRO units in and around Boston. We actually have a building in Lawrence also that we use the PFS money for. And we got referrals from social service agencies and health insurance companies and that type of thing to get people that were truly homeless and on the streets, off the streets and into housing. So what we would do is we would use our unsubsidized units to help people get into subsidies. So we would use the PFS money to assist with rent while we help them with the process to apply for subsidized housing. So I started to touch on it before, is we were able to help people get into permanent housing and help us be able to provide the services that we want to do. So if we have Cspec money or case management money available, that we're able to kind of get a case manager to help someone be in permanent supportive housing or housing that they can then manage some of their issues with to kind of help them stabilize so they can be more independent later. I think it's, things are really tough now anyway, so we won't get into all that piece, but things were tough before too, but they're really tough, and being able to kind of get folks to do the paperwork and get the services that they're worthy of is really so hard to do. And I think that if you're able to give them a place to live while they're doing that, it helps them be able to stabilize to get what they're worthy of.
Yes, just being able to go out and get my driver's license and able to pick up my health, medication. Through this process, I was able to go to a cooking class and become a chef, so that helped me. Well, for me, I was able to get a phone, and my family, I could get in contact with them. I was also able to get mail and be able to go to my doctor's appointments. Definitely, because they never knew where I was, and my mother, it really made her nervous. So she's like grateful every day because of that. My kids also know where I live, and able, to come over and visit if they'd like to.
My name is Dr. Latanya Wright. I'm the director of the outreach program at Hearth Inc. My role with the Pay for Success program basically was to administer the program, but also work with the case managers that supervise the case managers that work with the program. So the role that Hearth played with the Pay for Success program in terms of coordinating individuals' care, we were able to work with different agencies in a way that offered additional services. So we were able to definitely work with the City of Boston in terms of various surges. We were also able to continue in we're doing now, working with different shelters, ensuring that the individuals that were and willing to be a part of the Pay for Success program were housed, and following them with case management services. Services and case management, very important with individuals that are transferring into permanent housing. It's a way that we keep open relationship and communication with the landlords to make sure that the housing experience is working for the individual, but also to ensure that the individuals remain housed, whether it's helping them to coordinate and maximize certain benefits to help them, or appointments, whether it's doctor appointment, behavioral health appointments, whatever type of appointments that's needed to help them in the community and making the right connections. Some of the key benefits for the clients and the agency is definitely keeping an open line of communication, making sure that we were able to connect with other funding sources, other agencies, making sure that, once again, that the individual were able to connect with the needed resources to help them to remain housed in the community.
Changed a lot for me, made me feel back. I got my independence. I can do things. I feel proud again. Yes, Cecilia's always 24/7. It seemed like she's there for me. She helped me. She made me become more of a person. And with her, she was so good with me. She told me, you could do it, you could do it. And she was right, because Cecilia helped me get my certificate. There it is, I got it. She helped me get my certificate, and I'm so proud of myself because of her. I wouldn't have done it. Proud, happy, I got dignity again.
My name is Erin George, and I work at Action Inc. in Gloucester. Yeah, I actually started at Action as a Housing First case manager and was working directly with clients that were enrolled in the PFS program. And since then, I've moved on to a management position where I actually oversee the case management staff that we have that interacts with clients. And I interface directly with Mahasa around the program. I think the most important factor was the support services that we were able to provide through some of the leverage funds that we had, including Cspec, which was huge, that Mahasa did a lot of work on. It really allowed us to provide intensive case management to our clients. With the PFS program, we had people that had a lot of things going on in their life, and we were able to really meet them where they were at by embracing the Housing First model of being completely low threshold to the point of being almost like no threshold. So we've had clients who have been actively using substances or who are not receiving treatment for some of the mental health conditions that they have. So in order to keep those individuals housed, it requires a lot of individualized case management services, and we were able to provide that through PFS and with the supports that Mahasa had and the advocacy work they've done on Cspec, which allowed a lot of our tenants to flourish. I think expanding eligibility is extremely important based on the client population that we've seen coming in, who kind of are on the line of chronic homelessness, who have other issues going on, who don't quite meet that definition. And I think with PFS, we were able to house some of those individuals who didn't quite meet the benchmark yet. Through PFS, we were able to house one individual who had been evicted from public housing and had really no other options in regards to housing. He was at our shelter. He had a lot of health issues going on, and he was not quite at the chronic mark yet, but really didn't have any other options. So being able to get him housed when he had been homeless for around 6 or 7 months, I think, was huge to be able to make sure he had a stable place to start taking care of his health. But in other programs that we've seen, there is rather stringent criteria around the chronic homelessness piece, and I think for folks it can be really hard to meet that threshold, whether it be through hospitalizations or going through jail for a period of time. That time, depending on how many days they're in there, can count again. against their chronic time. So I think it's huge to be able to have some flexibility with the program to be able to meet those individuals where they are and not have them staying, whether it be outside or at a shelter, any longer that they need to. And I think PFS did allow some opportunities for us to use that flexibility to house people. And I think it's something that could be looked at a larger scale to make sure that we're meeting folks, because the work that has been done around chronic homelessness has been huge. But I think continuing to examine the issue of homelessness in general and the amount of time that someone is homeless, as well as the comorbidities that they might have and how vulnerable they are.
Bueno, mi vida ha cambiado por todo, ha cambiado porque yo anteriormente yo bebía demasiado, después lo paré y ya no seguí bebiendo. Me ayudó bastante la casa porque dije no, yo tengo que dejar la bebida. Sí, porque para mí es importante, porque a veces cuando yo vivía en el shelter, si no hay cama, uno dormía en la calle, ¿me entienden? Entonces, para mí es importante. Sí, uno se siente más seguro porque uno tiene lo que necesita en su casa y principalmente la comida y la ropa y las demás cosas.
My name is Heidi Nelson, and I serve as Chief Executive Officer at Duffy Health Center. I am the CEO at Duffy Health Center and am the main person for the organization that interfaces with the Massachusetts Housing and Shelter Alliance. I've been the representative from our agency for a while, and Joe Finn likes to have broad regional participation with Mahasa, so he's always welcomed us with open arms from the Cape and from other far-flung places around Massachusetts. So when this idea of social innovation financing, pay for success, the many different names that we've called it, came up, he really wanted to have a lot of broad input and perspectives into the program design. So he, and those of us who were particularly interested also kind of served as a little kitchen cabinet for Joe as we were working on that project. We have been a Cspec provider, community support program for ending chronic homelessness. I know it has had a number of different names over the years, but we have been providing case management services through that Medicaid reimbursement model for the past 15 years. So we were one of the original Cspec programs. At the time, Duffy were the Healthcare for the Homeless program here serving Barnstable County, so we provide primary care, mental health and substance use disorder treatment services for people who are homeless. At the time, we didn't have wraparound case management services for our patients, so this was the first opportunity for us to explore a new funding source for case management. That's how we got involved in Cspec, and I know that Cspec was kind of the baby of Mahasa. So these services have been really important to us through the years. So when there was the opportunity to expand the use of the case management services and the model throughout the Commonwealth and through this SIF model, we really wanted to jump on it so that we could expand the use of these services. it's striking the first time you see the data and the information about the intervention and the effectiveness in reducing the cost of mass health, as we call Medicaid in Massachusetts. And so it was a no-brainer really for the state, to take it on. So there really is no reason to not do it. Why would you not want to save state dollars by providing these case management services? And the way I like to talk about it is that it really is the humane and the right thing to do. People who have serious substance use disorders and serious mental illnesses that are untreated, and living on the street, living in shelters, they need this kind of support and assistance to move into housing. And what's great about this model is that it really is from soup to nuts. When we first meet somebody in the shelter or identify them on the street, we provide that support that they need because they're often not able on their own to identify different housing options, go meet with landlords, et cetera. So we can provide that kind of support to the patients. And then once they move in, and then we're able to provide the support afterwards. So it really is, it's a really important model, both for the state and for Duffy Health Center.
Welcome to the live panel part of our celebration today. My name is Robin Callahan, and I'm currently a vice chair of the board of directors for MAHASA. And I'm very pleased to be here with some people that will really help us shed a lot of light on how to really get things done and what happened in the implementation of this program. So as way as a background, I'll also say that I am recently retired in the last few years from Medicaid, Mass Health, as people are talking about, where I spent 30 years. So a lot of the discussion around how Cspec evolved and what it really became in the Medicaid program in Massachusetts is very close to my heart. And it's just so thrilling to see it really realized in an initiative like this. So with us today, we have Deb DeSantis. She is the president and CEO of the Corporation for Supportive Housing. Deb became president and CEO of the Corporation for Supportive Housing in January of 2007. She had joined the nonprofit organization in 2003 as director of CSH's New Jersey program. This is a national organization. CSH helps communities throughout the country create permanent affordable housing with services that prevent and end homelessness. They played a critical role in introducing the concept of social innovation to MAHASA and became a key investor in the Pay for Success initiative. We also have with us Patricia Lattimore. Patricia, now retired, was the Chief Operating Officer and Chief Financial Officer of United Way of Massachusetts Bay and Merrimack Valley, and a key architect of the operational and investment model that made PFS work. With a wide experience in financial management, Patricia had also long been engaged with solving the issue of homelessness. And then we have Audrey Shelto, President and Chief Executive Officer of the Blue Cross Blue Shield Foundation of Massachusetts, one of the earliest supporters of the Housing First concept in Massachusetts. Audrey presently leads the foundation's strategic agenda to broaden health coverage and reduce health barriers to care through grants, research, and policy initiatives. So I welcome you all and thank you for being here. It's an important discussion. It was just really great to hear all the testimony that went before us here. And I'd like to tie us to that. And perhaps we can start off, Deb, with you. I think that it might be helpful to to get the big picture here that you can really help us with a broad perspective on the concept of social innovation funding and why you thought it would be a good thing to bring here to Massachusetts.
Thank you for that question, Robin. First, though, I just want to give a big shout out to all the partners who are responsible for really getting this initiative across the finish line. And, you know, I don't think it has been said enough that over 1,000 people were housed because of this initiative with an 85% retention rate. So I think when you think about success through the lens of any metric, you know, that's just fantastic. And everyone really should, you know, pause and feel good about that. And so thank you to our partners, Joe, Mahasa, United Way, Blue Cross Blue Shield, Santander Bank. And I just also want to acknowledge my colleague, Ryan Moser, who was very instrumental and at the table for all the discussions and representing CSH. So thank you, Ryan. But so just a little bit of historical context, which I think is helpful. You know, this idea of social impact bonds, which is what it was referred to initially, was really something that originated in England and then brought over to the States by a number of organizations and philanthropy that were interested in exploring this concept of social impact bonds. And the concept itself, in its very simplest form, is this notion that you could attract private investors to invest in interventions that would lead to better outcomes. And if indeed the intervention achieved better outcomes, then government would pay the investors. And the idea is that the investors, rather than the providers, would bear the risk. And we don't hear referred to as social impact bonds anymore, really. What, you know, it's been called social innovation financing or pay for success. And, you know, CSH's interest and a number of other organizations' interest from the beginning wasn't so much on, you know, would there be this niche industry that would come about from the social impact bond, creating a social impact bond market. Our interest was really kind of this paradigm shift, if you will, this new emphasis on outcomes and performance-based outcomes specifically. And so we were intrigued by the idea and really wanted to look for opportunities to work in communities with partners that actually had a proven intervention that could be taken to scale. And in this case, supportive housing. I just, you know, I would add parenthetically that if you look at some of the other pay for success or social innovation finance initiatives that were pursued in other jurisdictions across the country, it's really the ones that took a proven intervention and then used that to take it to a different scale that were successful, as opposed to those that you know, invested in something that was new and had not achieved proof of concept or was not a proven intervention. So here you had Massachusetts, right, that had Cspec, which, you know, they really were the leaders across the country in looking at Medicaid to fund tenancy supports. You had a very strong provider community. And you had an organization in Mahasa that, you know, was a very strong intermediary. And for CSH, all of those things were important and very attractive. And so, you know, we were excited to be part of the initiative, to be an investor, and then also to be part of the learning community and help with the help lead the learning community, which I think is also a way that this initiative has distinguished itself from other initiatives in other parts of the country. But I'll stop there.
Wow, thank you so much, Deb. I think, one of the things that you talked about was building from what you already have and leveraging and growing from there. And I guess I'm just going to throw in before I move on to anyone else. One of the things that I can recall just in my professional life is what a Mass Health or Medicaid program looked like before Cspec. And I think that, one of the things that is really amazing to me is that through a lot of very vigorous advocacy and work of providers and folks like you, the case was made that being able to sustain a source of financing for supportive housing was going to lead us to other places. And I remember, I can remember some of the earlier conversations with the federal government Medicaid program about Cspec, and they're like, we don't do housing. If you use the word housing, don't talk to us anymore, And from that, a pilot program in Massachusetts starts. And from that pilot program, we start to expand to other parts of the population. And I think, when we kind of talk about how do we sustain growth, we leverage one innovation on top of the other. And so I guess from there, I'd like to go to Pat to talk to us about really how did this thing get implemented? What was the nitty gritty like? How did this thing work? And what did you have to do to make this successful?
Thank you. So I can talk a little bit about the model and the structure. And I think as you've heard from the video as well as from Deb, there were a lot of people involved in this. And one of the things that I think it was unique about this one is that this was a state program, the PFS initiative. And so the state came out and said, we want to do something that really focuses on outcome. And we want to involve, the private sector as well as the state government and the not-for-profit sector. What I think is, is so intriguing about this one was that Mahasa, under Joe Finn's leadership, as well as Tom Brigham's operational expertise, came together and said, we need to really go after this because we have all the pieces in place in Massachusetts, as so many other folks have said. And so they really went after and then brought together a team to really create MASH. And that team was, Mahasa with his proven model, the United Way, and I'll talk a little bit more about like what each of the participants brought to the table, but also the Corporation for Supportive Housing. But this work couldn't have been done without the state having the will to make sure that it moved forward. And the first thing that I thought about is that over the 2 years, and it did take 2 years to pull this, to launch this initiative with lots of meetings. And it's the first instance in which I have participated with so many various agencies, and those agencies from the state working for the same purpose, but also the two not-for-profits who are in their CSH as well as the United Way, and then of course Mahasa under its leadership, really focus on those outcomes of ending chronic homelessness for the population that we were addressing. And so I think that that's a unique kind of structure. But when we started thinking about this and did the initial planning for it, we thought that this would cost about $50 million, in excess of $50 million, or about $20,000 per head. And through a bunch of things in terms of looking at the savings for it, we got back that we could spend about $3,000 per head. And so you can imagine how fragile everybody was around, well, how can you do this? And I think that the success of this came about because the people who were in the room, and sometimes it was over 30, 40 people on a conference call or in the room from the state, as well as from the not-for-profit community, as well as our lawyers. And so I wanted to actually acknowledge all of the many law firms that actually worked on this as a pro bono effort. And so what we did was we started thinking about, well, how do you leverage current state resources and who would drive those pieces? And Robin, as you've mentioned around the mass health piece, that was the biggest chunk of it, of really going for that Medicaid waiver. And of that, that's about $11 million that got reallocated to this program. And so that's a really critical piece. In total, about $24 million came into the pot, $11 million from the Medicaid piece. But then also we got housing vouchers. And there were 145 housing vouchers that were dedicated to this program and that will remain with this program over time. And so that was about $7 million. And then the state program brought in $6 million of success payments. So there was $24 million of resources that were reallocated in the state to support this. Now, that didn't quite close the gap. We still needed about $3 million. And so one of the things that the United Way was responsible for was to actually go out and find investors. So we helped with the modeling of this, and with so many other people helped on that model. And we did the financial modeling because we had the skills to do it. But Dev mentioned Ryan Mosher. We spent many an evening with Ryan going over the details of the model. And also folks from Mahasa, Tom Brigham in particular, really trying to figure out how do you make these pieces come together? How do you get that money in a way that actually allows this program to function? We determined that we needed $3 million in investment. We started looking the United Way through our connections for some investors. And I think as has already been mentioned, the investors that we sought out, which were large, sophisticated financial institutions, really weren't looking so much for a return. They were not a financial return. They were looking for results. They wanted to be a part of a project that actually solved or began to solve the problem of chronic individual homelessness. And so we were very pleased when Santander stepped up to the plate and put in $1.5 million. $1 million for operational support of the program, but also $500,000 in philanthropy that would ensure the viability of the program going forward. And I have to say that the two not-for-profits that were who were investors, both the Corporation for Supportive Housing as well as the United Way, also became investors. And so one of the things that we thought about a lot was why? Why would we want to do this? Why would we take our monies and want to do this? And Deb talked about why CSH wanted to do it. And I can tell you that with the United Way, we really wanted to put our dollars in solutions. And this was an idea that had a solution. And so, and it was a proven concept with Home and Healthy for Good. So we didn't have something that was speculative and may not work. We knew that that program had been in our operations for a number of years, that it had been successful. The success rate there was at 85%. And so we set the target there. And so I think that that was the big piece. But the other thing that happened in this, and Deb has already mentioned this, was that CSH brought to the table a lot of deep understanding about programs that were working across the country, or what could work across the country. And they gave us the confidence to sort of move forward. And then, of course, as the program got operationalized, they also helped us with the learning communities. And that was an important piece, that feedback loop that came in. So I guess the thing is that it was a difficult process. It took a long time, but we actually pulled together a leverage model that pulled in multiple state agencies, corporate investors, as well as a not-for-profit group. And so that's what I would say was the major difference in this program. Lastly, though, I want to not forget the partner agencies. And everybody has mentioned that they were a critical piece of this because they were the operational piece. And one of the things that the United Way, in conjunction with MASH and under the leadership of Mahasa, really wanted to figure out how do you bring the partner agencies, the providers, into the mix. And they came into the mix because of our flexibility. And what we tried to do is to offer providers not just a cookie cutter kind of solution, but we tailored the mix of reimbursements to them based upon their needs. And so some folks wanted more housing vouchers. Some folks were more concerned, were happy with just the Medicaid piece of this. And then others needed more dollars from the reimbursement. And so we had to do a lot of mix and matching on that. But I would say that we were fortunate because we already had such a wonderful community that already had experience with this program. So in the end, the modeling was difficult because the funds had to be found. But I think the commitment from the state, from the agencies there, as well as from the Santander, from a corporate standpoint, and then from the two investors from the not-for-profit were the big change. So I'll end that.
Wow. Well, this was quite a feat, this collaboration. And I do want to return to just the issue of successful collaboration in a minute. But one of the things that you mentioned, Pat, a couple of times, and other folks have mentioned, is the importance of the initiative focusing on outcomes. That folks want to see results. And we talk a lot about evidence-based work. All of this, in order to really understand it, requires analysis, requires data. And what I'd like to do now is go to Audrey, because I know that the Blue Cross Blue Shield Foundation did some analytical work around the initiative. And Audrey, could you talk to us a bit about how you approached it and what your findings were?
Sure, I'm happy to. Thank you, Robin. And I'm really honored to be on this panel and part of this session. I was a very small part of this tremendous initiative, and I have such respect and offer such congratulations to everybody for all this work. So let me give you a little bit of context. Right after I started at the foundation as president about 8 years ago, we decided to focus on not only continue to focus on expanding access to health coverage, health insurance for individuals in Massachusetts, but also to focus on behavioral health access and on social determinants of health. Recognizing, as we all know, that so much of people getting and staying healthy has to do with things outside of the healthcare system, things like housing, food, safe environments, et cetera. So this was a new area for me, I'll be honest. I was, as old as I am, it was new to me. And so we got some fantastic consultants to do some literature review for us and say, when you think about social determinants of health, what does the literature say about what actually has some proven outcomes, both in terms of health outcomes, quality of life, and are there some that even show financial outcomes, savings? And not surprising to many, they came back and showed us the analysis and said housing is at the top of the list. in terms of having positive outcomes all the way along the continuum, even into savings. So we were, as a foundation, getting familiar with this work, and in walks Joe Finn, whose reputation had certainly preceded him. I had known of him. We hadn't done a lot of work together, but he walked in and asked me if the foundation would be interested in funding a study to show the effectiveness of the Housing First model on Medicaid mass health expenditures. You know, could the Housing First model save money in terms of mass health expenditures? So of course, first he had to educate me on Housing First, because that wasn't really my my background. And he told me all about the great work that's had been going on in Massachusetts related to Home and Healthy for Good, and then for this Pay for Success model. So it didn't take him long. He didn't have to use many of his magical powers to convince me, because it was intuitive to me that this program would have a really positive outcome, as we've just heard from many of the participants, in terms of, you know, introducing stability into their lives, improving the quality of life, letting people reconnect with their families, you know, bringing dignity back to people. So it's certainly, for all of those reasons, the Housing First program sounded like the right thing to do. But Robin, as you were just alluding to, whether you're a philanthropy or whether you're a public funder like Mass Health or any other state agency, or an investor from the private sector, you know, you do tend to look for, you know, what is the financial result of these types of programs. So we agreed with Joe that we would fund a study to look at the financial impact of the Housing First initiatives. So we set up a study. Joe worked with a group of consultants, and we were sort of, you know, partnering with him in through this whole process, which took quite a while, and looked at people who were enrolled in permanent supportive housing, and looked at an exact same group of people, sort of matched on age, gender, you know, all sorts of factors, health conditions, who were not participating in the program. And we looked at those two populations, so participating in the program and not, and we looked at their healthcare utilization and expenditures before they participated in the program, and then after they participated in the program. So I'm now not a statistician, but so sort of pre-post, you know, a control group and an intervention group. And we worked, Robin, you'll remember this part, we worked with Mass Health to get a whole bunch of claims data in order to do this analysis, you know, to really understand, you know, what the utilization patterns were for these individuals. And it was over 1,000 individuals that we were able to match in that way. What the costs were, you know, we had to get all that sort of baseline data, and then after the program participation data in order to do this analysis. So a lot of collaboration with Mass Health and Mahasa to collect this data. The program, you know, the housing was the housing. The program was, as you've all described and several people before described, was the Cspec program, which also I was familiar with it, for having been in behavioral health in many previous jobs. But the marrying of that with housing, into a model of permanent supportive housing, was really new to me. As we did this analysis over many months, analyzing the data with Joe and his consultants, and what we found was really significant, as you heard the woman who runs Duffy Health Center say. People in the program had significantly lower yearly healthcare costs than those who are not in the program. And when I say significantly less, I mean over $5,000 less per year per person as a result of participating in the program. And I maybe I shouldn't say as a result, and again, I'm not a statistician, but everything was matched in terms of these two populations, you know, literally, like their utilization before the program, their medical conditions, everything. So I'll just say those that were in the program had annual costs, healthcare costs, that were $5,000, over $5,000 less than those who didn't participate in the program. And what was interesting within that, which is not surprising to those of us and many of you who work in behavioral health, as well as, when I say behavioral health, by the way, I mean both mental health and substance use disorder conditions. But what was interesting within the bottom line number of the savings was that actually people who participated in the program used much more in terms of mental health and substance use disorder services than people who were not in the program. But the savings on the medical side in terms of emergency room visits, inpatient hospitalizations, ambulance visits, those savings were so big that they more than offset by over $5,000 the cost of people using more mental health and substance use disorder services. So the bottom line for this was fantastic. You know, we could say, going back to where I started with this, in the conversations with Joe, this is so clearly the right thing to do from a personal perspective, from a dignity, from a quality of life perspective for our neighbors and other people, you know, all the people in the Commonwealth. And now we have some data that shows with an investment into permanent supportive housing, not only do we get better results for the individuals who participate, but we actually can reduce Medicaid spending, which is a really important priority for all of us. So it was, and for me personally, it was also really validating to be able to show that investing more in getting people access to behavioral health services, whether it's mental health services, substance use disorder services, or more likely both, is really important in terms of achieving those bigger long-term savings for those much more expensive and intrusive in people's lives, areas like hospitalizations, emergency room visits, et cetera. So we had, as I said, a small part in this whole initiative, but I think a really important part, and we were thrilled to be part of it.
Wow, that's fantastic. Thank you, Audrey. I mean, this is getting me even more excited just to kind of hear you talk about this, because I mean, really kind of what it's leaving me with is you know, a true understanding of why we're celebrating today, and a true appreciation for all the work that all of you have done. Not just those on the panel, but all the folks that are listening today. And it's really an amazing tribute that people have been willing to put this work in to see these kind of results. I think, you know, I'd like to kind of talk a little bit, dig a little bit more. I'm going to go back to Patricia's discussion a little bit more, because this is a complex thing. The issues are complex, and the participants to make things work are many and complicated. And we're talking about sort of an alphabet soup of agencies on the federal side, on the state side. We're talking about bringing in private investment dollars, nonprofit world, the provider community. And not to mention the fact that we all have to stay focused on the people we're serving, and what their particular inputs or needs are. So I guess I want to kind of, since you're all in your own roles, really done major convening work. I think all of you, as I look at you, have had that to do. But in particular, in a complex issue like this, and maybe Pat, you could start us off. What is the key to herding the cats here, right? You know, and not only what is the key to herding them, if you are an individual cat, right? What is the best way for you to participate? What do you know, what makes you a good participant?
Yeah, Robin, that's such a great question. But what I think that the key to herding the cats in this particular interest, in this particular initiative, was that each of the cats actually had the same goal. They all wanted to make a difference around individual chronic homelessness. And so, you know, whether it was CSH, who has been working on this issue for decades, or whether it was the United Way, which one of our pillars was around homelessness and ensuring that people had safe places to live. And then, of course, having Mahasa in the play, which, you know, as a core function of their work. But I think that the interesting thing was the leadership that came from the state. And I don't want to credit or discredit anyone in the state, but I know that, you know, Arthur Jennison was the keynote speaker. And from our standpoint, I think that he provided a lot of leadership in terms of helping to pull together the agencies into place to actually have a conversation about this. Now, this wasn't for any of them, and I know Robin, you at Mass Health were already in that space. But like Audrey said, for all of us to get onto the same page that housing was the first step, was a critical piece. And so maybe Deb, you could talk a little bit about like that evolution of housing first for the whole of the country.
Yeah, I have so much to say on this topic. So, hopefully I'll make some sense. How do you herd the cats? So, I think one of CSH's goals through Pay for Success has also been to get at this question of wrong pockets, right? So the kind of the pushback we get in every community when we try to get different systems to the table is that, oh yeah, if it's the correction system, they understand how folks in their system are touching the homeless system, but they don't see it as their responsibility to be part of the solution. So they don't bring, resources and thinking to that conversation. And I think the beauty of what the Pay for Success initiative did in Massachusetts was, as everyone has said, was bring all those decision makers to the table. And so this question of wrong pockets was never had. It really was about what resources do you have, what's your role in not the problem, but in the solution. And I think that has just been so important. I often say that our goal cannot be to build a bigger, better homeless system. It really has to be about creating that better system of supports. And so again, I think what the Pay for Success initiative did was really focus the conversations, the collective conversations on how do you go from crisis response to building that system of supports that really focuses on housing as that platform for improving the outcomes that Audrey talked about. And so how do you get those people around the table? It is, part what Pat's talking about, that leadership, having someone like Arthur who can reach out to their colleagues and invite them to that conversation. I think it's also not getting so stuck in, I don't know anything about housing, so what am I going to contribute to this conversation? And just being open to being part of the dialogue and coming along and figuring out what the touch points are. And I think we saw that throughout the process. Different partners at the state level coming to the conversations and experiencing their own aha moments and saying, oh yeah, okay, now I get kind of the intersection of my system and these other systems. So I think it's leadership. I think it's, someone being able to say, this is important and we all need to figure out our role. I think it's using the data to help make that case for the different partners. And I think it's also just putting that vision out there, like I think Joe did and the partners did, to say, here's what we're trying to achieve, and we'll figure this out together.
Great. Now, I think as we start to think about winding down this session, I think one of the things I want to make sure we leave with is a sense of the future and how this initiative and the success of this initiative poises us for the next innovation or the next thing that we need to move on to, because we, and back to the data piece, as we show that certain things work, we need to make sure we can keep doing those things or do more of those things or expand those things. So if we could just kind of take a brief moment and say, what in this whole initiative do you see as a lasting contribution that we can leverage going forward out of this experience? So let me start with Pat, if you don't mind. Pat, what is the thing, what do you see coming out of this? And I'm going to sort of prompt a little bit, because one of the things that I've been really impressed with is this MASH model that seems to be really kind of useful for a lot of different things going forward. But is that something that you think will outlive this this initiative?
I certainly do, Robin. I think that one, creating MASH as an intermediary to deal with issues of homelessness was critical. The initial initiative was really around individual chronic homelessness. And clearly we have to look, at youth and families and actually start to get at some of the root causes of homelessness. And so I think that MASH is really perfectly poised for that. And, a couple of the folks in the video actually talked about some things that we could do. I mean, clearly there's the safety net pieces that we need to ensure that state funding remains flexible and that it could actually provide the wraparound services that are needed to, for the individual chronic homeless, but also for family and youth. So I think that those are the pieces that, we could actually work and advocate. MASH could be an advocate for those types of changes. And then, of course, I think that one of the big things is around building more affordable housing. I mean, because you got to solve that problem. I mean, and I'm so pleased with the Blue Cross Foundation, their report, because it showed that you're saving money. So now you're saving money, but how do you reinvest that money into, housing, or find other places where we can do that? And I think that that's an important piece. And I think that MASH will be a leader in that. And so I do think that MASH is here to stay. And that's one of the great outcomes of this.
Great. Deb, what would you say? I mean, what do you think survives this project?
Yeah, I agree with Pat. I think MASH serves as a blueprint for how how you expand beyond the initial targeted population and really get at those other systems that folks are bouncing back and forth between, right? So, folks are experiencing chronic homelessness or long-term homelessness. We know about 40% of people who experience long-term homelessness have a history of child welfare engagement or a history of justice involvement. And so now you have this template, if you will, through MASH, where, different government partners have come together. They've partnered with the provider community. They've partnered with the investment community, and the emphasis really is on how do we achieve better outcomes. I think the community is now poised to really expand this partnership. And I would just say, I think this work clearly has been a model for other communities. We worked with Denver, and they used the Massachusetts experience to model their own pay for success, and they targeted those experiencing chronic homelessness with a history of justice involvement, and are now in their pay for success, their second iteration of pay for success. So I think it's, all the mechanics are there that now give the community and the partners the ability to kind of think bigger and expand the partnership.
Right. And finally, Audrey, now that you guys have, really helped us understand the outcomes with the data work you did. And I know that Blue Cross Blue Shield Foundation is in a broader sense, looking at social determinants of health generally. How does this add to that? How does this help advance this experience, help advance those issues?
Sure. Well, I think, listening and learning from, preparing for and from the presentation today, just validates my own experience that, to state the obvious, we all live complex lives. But for people who are chronically homeless or have other and have significant behavioral health and substance use disorder issues, their lives are very, very complex. Others here have mentioned, involvement with the child welfare system, involvement with the criminal justice system, food insecurity, housing instability, all of that stuff. And what this program and this initiative has validated for me is that even though it's really hard work to break down, I hate to use trite phrases like silos, but to break down those silos and start working together to really address the whole person, with all of our messiness, we're whole people, and that it can't be just one of these sectors that's doing an intervention and expect that we're going to get positive results. It has to come from weaving together a whole array of services. And I think, as both Pat and Deb have said, meeting people where they are and helping them on their journey to recovery, stability, dignity, and higher quality of life. So this initiative has really just validated, sort of an intuition. And now we've got, some much needed data to show that it's not just improvements in quality of life, but we actually can generate savings that can be reinvested in expanding programs like this, which is so exciting.
It is. Thank you. And I thank you all. We're going to wrap up now, but this has been a great discussion. I could talk to you guys all day about this. And I want to again congratulate everyone who was a part of this initiative. What fantastic work you all did. I have to do a special shout out to my friend Joe and his Mahasa crew, because for them to kind of push us all, keep pushing through their advocacy for these type of innovations has been, certainly important in my own professional life, and I see that it hasn't, that has affected all players in this. So thanks again. And with that, I'm going to sign off and thank you all for joining us today.
Thank you so much. I want to thank all of our panelists this morning for what I thought was a pretty informative discussion about Pay for Success and the Massachusetts Alliance for Supportive Housing. And I also just wanted to take a moment to thank everybody for participating today. And, I really always felt about this project that it really filled that old saying, it's really amazing what you can accomplish when you don't care who gets the credit. And that's the way everyone had worked through with this. And so I really need to thank CSH, especially Ryan Moser, who Deb mentioned, United Way of Massachusetts Bay and Merrimack Valley, and another person we can't forget in case he's watching someplace, but Jeff Hayward. And finally, last but not least, Santander, who at that particular point in time, Gwen Robinson was again played a very important role. I'd also like to thank Emily Dobbins-Beck of Mahasa for the overall production of this event. It took a great deal of work. I'd also like to thank Ruth Leal of Mahasa and Jack Payne for the film production and editing of the film parts of this. It's also important, I think, to thank former Governor Deval Patrick and his administration for the innovation of PFS, and to also thank Governor Charlie Baker and his administration for its faithful implementation of the program, but also for the continued innovative expansion of community supports and housing, which is critical. I want to say here and now that this celebration is not the end of anything. The Massachusetts Alliance for Supportive Housing will continue to be an active force in the promotion of housing for every person and family in Massachusetts, including young people as well. But I think it'd be appropriate, if we could, is just to end as we began with a thank you to all of those workers in the homeless and housing field, doing all they can every day to ensure successful tenancies of those with life-limiting conditions and that have experienced homelessness. They are really the primary cause for and of all the success of the PFS. So I want to thank all of you very much. And again, I want to wish everyone a good day.